to another Ask the Expert session. Dr. Johnson and Kathy again. Kathy, so this week, have you had any interesting questions patients have asked you?
Actually, I do. Yesterday, I had a patient. She was asking, do I always have to get numb when I come to the dentist?
Good one. So the answer is yes and no. Yes, you do, right? Yes, you do, because if we're doing a procedure that requires us to drill in the tooth and it's pretty deep, that we have to say fill the tooth and we have to get the cavity and it's pretty deep, then you're going to want to get numb, because the worst thing you can have is sitting there not numb, wondering when it's going to start to hurt and just be so tense in the chair. So for situations like that, I would for sure say from the get-go, just get numb, don't even worry about it. Now, I understand and I know that a lot of patients, the biggest fear they have is getting numb and having the injection. And say they may choose not to get numb if possible. And sometimes that can happen, right? It's going to be okay. For example, if you have a very, very shallow cavity and it's tiny, you have a high tolerance for pain, you could realistically clean that out and not feel very much at all. So in that situation, for sure, yes. Another situation is there's other things you can use, like when we do cleanings and you are sensitive, we have a special numbing gel that's specifically for that we can put on the gums and help not make it so sensitive when you have cleaning. So there's different other ways and things that we can use to get around that. And it just depends on what you can tolerate. So I think the best thing is see how deep the cavity is. Ask the dentist, because there's sometimes some situations that I will say, yes, you can, and patients are perfectly fine.
Yeah, communicate with your dentist and we'll come up with the best solution for you.